Imagine being told, like, there's a $50 a month path to life-changing weight loss medication, but, only if you can navigate a total maze of Medicare red tape.
Oh, yeah, it really is a maze.
Right. Well, welcome to this deep dive into the newly launched Medicare GLP-1 Bridge Program. Our mission today is to, decode these complex rules so you know exactly how to access this new benefit. And just a reminder, we are not doctors.
Right. Definitely not doctors. But we are here to help you untangle this massive policy shift that just went live on July 1st, 2026. Because this bridge program is huge for people who have been priced out of obesity treatment.
Yeah, it really is.
But it's highly specific about what it actually covers and who gets it.
Well, let's get right to the medications, because people hear GLP-1 and they think of, a dozen different brands. Medicare isn't just handing out a blank check for all of them, are they?
Oh, far from it. The Bridge program covers 3 specific options, right? So you've got Fandaio in tablet form, then Wegovy, which you can get as either an injection or a tablet.
Okay, and what about Zepbound?
Right, Zepbound is covered, but specifically the QuickPen only. So if you're looking for the single-dose pens or vials, they won't be covered under this specific program.
Got it. So do you actually need a drug plan for this, or is Medicare just handing these out? It feels like getting past a velvet rope at a club.
That is honestly a perfect way to picture it. You absolutely must have a standard Medicare Part D plan.
Okay.
Or, a Medicare Advantage plan that includes prescription drug coverage, which is sometimes called an MAPD.
Yeah.
The Bridge program basically operates outside your normal coverage to give you that $50 price point.
Right, I see.
But holding that standard Part D ticket is your non-negotiable entry requirement to get past that velvet rope.
Wow. So having a Part D plan gets you into the building, I guess. But, because having a Part D plan is just the first hurdle, we really need to transition to the specific medical exclusions and requirements.
Right, the actual checklist.
Exactly. I imagine there's a pretty strict checklist that determines if you actually get the medication at the pharmacy counter.
Oh, yeah, there is. And the exclusions tell us a lot about Medicare's strategy here. For instance, you are excluded if your drug benefit is managed through an employer or union retire plan, which is an EGWP.
Right, those are pretty common.
Exactly. Or if you have a private fee-for-service plan without Part D. But the medical exclusions are even more telling. If you already have type 2 diabetes or sleep apnea, you're out.
Wait, really? Why would having diabetes disqualify you? That seems totally counterintuitive.
I know, but it's because Standard Part D already covers GLP-1s for those specific conditions. Medicare is explicitly targeting obesity as a primary chronic condition here.
Oh, I get it. They don't want to double cover you if you already have a pathway to these drugs.
Exactly. Which brings us to the strict medical eligibility tiers. It's all about prioritizing those with the highest immediate cardiovascular risk. First off, you must be 18 or older.
Makes sense. And then what?
Then you have to fit into one of 3 categories. The first one is pretty straightforward. You need a BMI of 35 or higher.
Okay, but what if your BMI is, say, lower than 35?
Then you'd look at the next tier. That requires a BMI of 30 or higher. But, it must be paired with specific conditions like heart failure or chronic kidney disease.
Oh, wow. And there's a third tier.
Yeah, the third one lowers the BMI requirement to 27 or higher, but you must also have prediabetes or a previous stroke or heart attack.
Those are some highly specific clinical targets. So, practically speaking, do you have to visit a traditional doctor to get this ball rolling? Or can online physicians prescribe these?
Well, legally, any authorized provider who isn't on the Medicare preclusion list can submit the mandatory prior authorization. So yeah, that includes telehealth.
Oh, nice. That's super convenient.
It is, but you do have to proceed carefully. See, the AMA, the American Medical Association, formally opposes exclusive telehealth discounts.
Wait, why do they oppose it?
Because they feel it fragments care. It undermines the relationship you have with your primary doctor. Now, we aren't taking a side there, but it's important context on how the medical community views these online prescribing models.
Absolutely. It's just a lot to navigate. If you don't know whether you're eligible or if your plan qualifies, what is the absolute easiest way to check?
Oh, skip the guesswork.
Yeah.
Just ask your pharmacist to run the claim they receive immediate bridge confirmation. Or, you can always visit medicare.gov/GLP-1 bridge to check.
That is definitely the way to do it. Just let the computer figure it out.
Right. But I want to leave you with something to ponder. This bridge program is temporary.
Yeah.
It ends in 2027. So if the eventual release of generic GLP-1s dramatically lowers drug costs, will these strict BMI tier systems become entirely obsolete?
Oh, that is a really fascinating point. Something to definitely think about. By the way, this is part of a series called Elton's Health Hacks. Please follow us on Facebook, TikTok, Spotify, or YouTube for the latest health tips. And the name of the series, again, is Elton's Health Hacks.
It's going to be interesting to watch how this all unfolds.
Definitely. To wrap things up today, let's remind everyone exactly what those 3 BMI tier levels are one last time. You need to be 18 or older and either have a BMI of 35 plus or a BMI of 30 plus with conditions like heart failure or chronic kidney disease, or a BMI of 27 plus with prediabetes or previous stroke or heart attack. Thanks for joining our Deep Dive.